My name is Kristen Wheeler. I'm an 8th semester nursing student, and I will be talking about chest tube information today. Most patients get chest tubes for different things such as blood, air, fluid, pus, anything like that that accumulates in your lungs. So our patient today already has a chest tube. So when I would get here for the day, I would obviously come in and assess the chest tube. This one is saturated, the dressing is saturated, but for the sake of this video, I'm not going to change it, but in the real world, I would go ahead and do that. With a patient who has a chest tube, you definitely want to assess, like I said, the dressing. You want to monitor their vital signs, make sure that they're really taking the chest tube well and that they're tolerating it good. Other things you want to look at, you want to make sure that the tube is not kinked and make sure that it's definitely not clamped off. You also want to make sure that the full system is below the chest tube insertion site. The actual drainage system has 3 different, I guess, chambers that you call it. This is what your pus or blood or fluid or anything like that will accumulate in here. It also has like a water seal chamber, and that's you'll put water in there and it'll turn blue when it gets to the right amount of level. And when the patient is breathing, it'll kind of be like a wave, and that's good. But if there's bubbles coming in there, then that means there's a leak or the hole or something in the tube anywhere. So you just want to assess that. And then this last one will be the suction. Now, depending on the physician's orders is what the suction will be set on. So just make sure that you have that correct. Now, whenever this gets filled up, you will want to completely change out the whole drainage system. You don't want to empty it out and try to refill the same one. And that's normally a 2-person job, makes it a lot easier. Also, if it gets knocked over, you want to change out the whole system as well. So definitely want to make sure that you're not kicking anything over, and just make sure you watch where everything is.